Hi there, my name is Gideon Bletcher. I'm a urologist from Melbourne, Australia, and I'm going to discuss briefly with you the concept of buried penis and its implications. For the primary care physicians, buried penis can often be a somewhat confronting issue, as it's often hard to find out who to turn to get assistance for patients with this problem. So what is the problem? Essentially, a buried penis is a penis which is internal, often hidden behind larger amounts of genital or abdominal fat. There can sometimes be skin conditions, most commonly lichen sclerosis, which can also form a secondary problem, and that is some form of a cicatrix, which is a tight ring band behind which the penis can no longer come out. So essentially, it's a phimosis. But it's a phimosis not just of the penile foreskin, but also sometimes of the abdominal or genital wall skin. And this prevents the penis from being able to be in an external location. And this has significant ramifications, not only from a sexual perspective, but from a voiding, hygiene, and comfort perspective. These men often find that whilst they have an erection that might be normal, it's hidden behind everything, and the tissues rise up and make sexual penetrative intercourse an impossibility. The hygiene issues arise because urine will often get trapped, causing excoriation or inflammation of the skin breakdown, and subsequent infections, both bacterial or fungal. And this in turn causes discomfort and pain. And as a result of all of these, there's going to be a psychological factor as well, impacting these patients' overall health and well-being. So how do we go about managing it? Well, obviously weight loss is key, but it's not going to necessarily get rid of the entire problem. Whilst it may help improve their surgical outcomes at some stage later, it's not going to resolve the problem in of itself. Really, what these patients need is a referral to either a plastic or urological surgeon who is familiar with dealing with buried penis. Often we find simply by removing some of the fat, be it either with excision of the fat or liposuction, that may help address the problem. But if there's any form of a tight band, that's not going to solve the problem. These patients need an excision of all the affected problematic skin, which will often then leave the entire shaft of the penis without any skin coverage, and therefore they often will require some form of skin grafting or local skin flap reconstruction to solve this issue. So I hope that's been a helpful introduction to the concept of buried penis. And for more information, please head to the ISSM website. Bye for now.